Joins me now, and I've just got quite the schedule here this morning. This is more fun than I planned on having. Robb is CEO of Henry County Health Center, and we do want to talk about a couple of different things here, Robb. And I guess COVID-19 is still at the forefront of what's happening in healthcare. And given what Henry County Public Health recently put out as an update, we're not, it's not changing yet here in Henry County. As far as I can see, the numbers, the data is still showing us in a high transmission category. Yeah, I don't know. As far as Henry County Health Center is concerned, what are you thinking? Where do you see things here?
Well, first, good morning, Teresa. Thanks for having me on this morning. And, I would just start with, the last, it's almost 19 months now. We've been battling the pandemic. It's not just healthcare providers, it's all of us. Mm-hmm. And the last, we all remember the big surge in November, October, December of last year when it was real intense, and we all had to make a lot of different mitigation efforts and stuff like that. And we all thought we were kind of through the worst of it as the summer started, and many of us hoped that. And then, the Delta variant really took off. And it's been incredibly impactful for our health center and every healthcare provider, anybody who works in healthcare throughout our state, our community, our region, and along the nation. And I would say, I just want to first do a big, sincere gratitude to our associates, our volunteers, our amazing medical staff who care for our region, the public health, all our public health leaders and our staff who work tirelessly through this, because it's not done. It is, we're still in the thick of it. And I would say that, what we've done over the last few months has been more impactful and more, it's been harder to care for as we did even last November and December. And the reason why it's multifaceted is really because there's a few factors that really play into that. One, this Delta variant is more contagious than what we had last year. Secondary thing is there's a lot of acuity from all the other patients or other illnesses that are just normally exist, right? From anything else, people are sicker. And so with that, you've got the COVID patients tend to be younger and they're sicker, and that's different than from where we were before in the midst of one of the greatest workforce challenges that we've all had throughout our history. I've been in healthcare now 25 years, and I think that's multifaceted. You've heard where people have talked about the Great Resignation that was coined by a Texas A&M professor that really started this last spring, and we've all seen it. It's not just healthcare; it's every industry has gone through that. And when you have a staff that's been battling this pandemic and working tirelessly for 19 months, many people are at the point of exhaustion, fatigue, burnout. The word probably doesn't cover it anymore, but yet they're still showing up and they're extremely committed in caring for our region. And so I that's why we continue to push for a number of different mitigation measures, because we're not done. Yes, it's a little bit lower than it was 2 weeks ago when the state hit its peak of hospitalizations and maybe positivity numbers, but we're not out of the woods by any means. And
well, I heard someone use the phrase marathon.
Yeah, it's definitely a marathon rather than a sprint. We hope the marathon finishes soon, and because we definitely need to see some change.
Well, and there's a key to this, and that's something else we want to talk about.
Right.
Vaccines, getting vaccinated. I hate to say this, but I think if people would have gotten vaccinated 3 or 4 months ago, we wouldn't have seen the Delta variant take over like it has. Now, that's my unprofessional opinion. I personally think it's important that you get vaccinated.
Yeah, and vaccines are making a difference. And we still continue to strongly encourage everyone, if you haven't gotten vaccinated yet, please sit down with your personal primary care provider, talk through those issues, spend time with them. They're your source of truth, not not the internet or anything, your primary care provider will provide you the information because it does make a difference. And we have data now to show that, just to put a reflection on the impact of COVID has had, every year, unfortunately, we lose anywhere from about 38,000 individuals to auto accidents, and then we lose on average over the last 10 years, it's shown, with the exception of last year, we lose about 36,000 people to influenza, and we're over 700,000 with COVID. Mm-hmm. And just from the time frame of from May to August of this year, there was about 181,000. And of that was 1,400 were vaccinated. That's a 0.7%. The data is also showing it really reduces your risk of severe disease, of hospitalization.
Well, and
that's
key when you talk about,
right,
where we're at with hospitalization. Not just, there's finding the beds, there's
right.
having the people to take care of the COVID patients. Right. I mean, there's a lot that impacts as well. And I haven't looked at the numbers yet for our regional, as far as the region numbers, region beds. And I do know, you care for folks down here as well.
Right.
At Henry County Health Center.
Yeah, and that's the thing, we've seen a 66% increase in our admissions since the month of July. And so that's a pretty significant impact. And so if we're seeing that, imagine what our colleagues over at Southeast Iowa Regional Medical Center are seeing over in West Burlington, Fort Madison, but think about the university, Mercy, and everyone throughout the state. And that's why I started with a shout out to all the healthcare providers in our local area and throughout the state, because we have to remember they're heroes and they've been in this through it. And I'm just so grateful. But we need to continue to be diligent because our steps we have from vaccines, which are one of our best ways to continue to move forward, mitigation, good, safe practices, and and if you're sick, stay home. Mm-hmm. So those are things that we can keep us where we can keep going forward, and then making sure to work with your primary care provider to work with that going forward.
A couple weeks ago, there were 3 of us out here at the station that were experiencing COVID-like symptoms. We all 3 had been vaccinated. We'd all had it, but we all went and got tested.
Yep.
Because that's what you need to do. I mean, and we named the desk out in the lounge the isolation desk because that's where I spent the whole week, was at the isolation desk. Even after I found out I was negative, I still stayed out there in order to keep everybody else in the office from getting sick. But there were 3 of us that for various reasons had colds.
Yeah.
And then a flu bug, a stomach bug.
Right.
So
yeah. Breakthrough infections do occur. I mean, that I think everybody said that when the vaccines became available. It wasn't that breakthrough infections weren't going to occur, but what it was really going to do is significantly, and that's what the data is showing, is significantly reducing your risk of a severe disease or even worse. And so that's why we just need to continue to practice good mitigation measures, be safe, protect each other, and then I do believe we're going to get there. I mean, science is keeping up. There's some things that are being introduced here at the national level with the FDA about maybe a new oral antiviral. Just like, I want to do a big shout out to our staff and medical community. We do the monoclonal antibodies, which make a huge difference. Mm-hmm. But those are even on allocation. We could only get so much because the nation was just using them at such an expedited rate. We all got reduced on what we got for a period of time because of how bad the surge was throughout our country. So, but I do think science will keep picking up, and then we will be able to move forward. I am hopeful of that, know of that, and we'll be able to get there.
All right. Speaking of moving forward, since July 1st,
yep.
Henry County Health Center has been in this partnership. And first thing I want you to clarify, for me at least, you mentioned Southeast Iowa Regional Hospitals, Burlington or West Burlington, Fort Madison locations, right?
Okay.
So is Great River Health System still is that still a name, or is it Southeast Iowa Regional Hospitals?
Yeah, so I'd be
Explain
happy.
that.
Yeah, no, I'd be happy to clarify that. So the system's name is still Great River Health System, and we call it Great River Health. So that's still the name of the system. This past July is just when we started with our operational lease with the health system. They also went through a big transformation on those two campuses where Fort Madison Community Hospital and Great River Medical Center combined and made a new hospital name called Southeast Iowa Regional Medical Center. And Southeast Iowa Regional Medical Center has two campuses, West Burlington and Fort Madison. So, the Great River Medical Center name isn't there, but Great River Health System is still the system's name. And, our name is still Henry County Health Center within that corporate structure of Great River Health.
So it's like the umbrella.
Correct. It's, the over, like Unity Point Health, Mercy One, that would be the name of the system. And then each different hospital will have a unique identifying different name within that system.
And Fort Madison is a different relationship than with the West Burlington. They are one now.
They're one
That's
hospital.
a different relationship than what Henry County Health Center has.
Correct. And we're correct. It's completely different. We have an operating lease. And so it's this incredible public-private partnership where the health system still is in this public-private partnership with the Board of Trustees to be able to deliver healthcare in our community. And it's been tremendous. The first 3 months have gone just better than we could have expected. One, we're fortunate that we work together, throughout all this with the pandemic, and we're working together as we care for the region. We're talking about where people can go. We're working as where's the best places for everybody to be, who can care for what, making sure everybody has appropriate resources. So I'm thankful for that. And then really, we know that we're only going to be as good as we can care for our region with our people. You heard me mention some of the biggest workforce challenges. And again, healthcare is seeing it just like everybody. So, we're really trying to focus on how do we support our staff, how do we support our medical staff, everybody within our region. And so, we're really making some really wonderful initiatives on how we support them and do things. And then at the same time, we thought it would help stabilize the finances and the operations of the health center. And we're seeing that, and so that's what we expected. That's what we're seeing. And so therefore we can continue to focus on our people, which will then allow us to continue to provide outstanding quality and deliver amazing service for our patients and our communities.
When you talk about the changes, trying to go, make sure that the hospital is answering needs and functioning within today's healthcare environment, and making these changes with, in entering the partnership with Great River. Henry County Health Center has been able to maintain its presence here in our community for 100 years because this is what has been happening for 100 years.
Right.
It used to be the Soldiers and Sailors Memorial Hospital. Well, then the name was changed. Oh my gosh, I'm sure that was caused concern. Lots of construction additions, different arrangements of partnerships.
Right.
It has to keep happening so that 100 years from now, we still have that place,
Yeah.
And that's this year, 100 years, right?
It is. Yeah, no, thank you, Teresa. And it is, so December 2021 is a special time. It'll be the 100th anniversary of the health center. And you think back to 1921, we're a very committed trustees, individuals, community came together to say, we need a hospital. And they did that. And that was, I was going to say groundbreaking. Obviously, it was groundbreaking, but it was incredible. And then you really reflect over the last 100 years. And you just, as you mentioned, you go, wow. You think of the time, the energy spent by some amazing medical staff who've provided and cared for our associates, everybody, volunteers. We've got amazing volunteers today. We've got amazing volunteers in the past who've made a huge impact in lives. And then you think about all the leaders, our trustees, the executives, and all the changes we've been through. And I think the rich history of our organization has always been about how do we continue to innovate and evolve and adjust so that we can be here for our community. I'm extremely passionate about making sure we deliver top quality healthcare with amazing people. This community has been wonderful for me and my family over the last 25 years almost. And to me, that I want to continue to make sure to give back. And that is reflective of our crew. That's reflected of the initiatives and mission of the health system, Great River Health. It's empowering people, transforming lives, and fulfilling dreams. We want that vision to really make a difference in Southeast Iowa. We believe it. We look to make sure that we can continue. And this partnership with that over 100 years will just allow us to continue to expand. And so we're excited about that. It's going to be I don't know what the next 20, 30 years, no one knows. But I think we've positioned ourselves, just like you think back over the last 100 years, we've positioned ourselves to continue to be very strong and be here for generations to come to care for our community. And that's what has past leadership, past trustees, medical staff, associates, volunteers have done over the years.
All right. Well, Rob, I would like to keep you here another half an hour, but I should probably let you go. And we kind of unpacked a lot today, but resources are available. As Rob said, if you've got questions, your own personal healthcare provider, your doctor, is the person you should start with. Yep. Ask your questions, share your concerns, and be aware that Henry County Health Center is doing the best for you. And whether that means treating you here or treating you in West Burlington, or maybe you're in West Burlington and you need to come here, that's what it's all about, is wherever you can get that best health care and know that everybody's looking out for you and taking care of you.
Amen.
So,
yep.
Robb Gardner, CEO of Henry County Health Center. I'm very pleased that you wanted to come visit with us today. Thank you.
Thank you, Teresa. Thank you for your time.
Corn and soybeans both showing some positive action here as we get ready to wrap up the overnight session. This is Market Matters on the Iowa Agribusiness Radio Network, brought to you by the Nature Conservancy. I'm Dustin.